Look, I've been a urologist treating erectile dysfunction for over a decade, and I've watched men over 50 drain their retirement savings on treatments while the solution was sitting unused in their home the whole time. I'm done. Staying quiet. Hello, gentlemen. I'm Dr. kenD Barry. What I'm about to share could help improve your erectile function using a device you already own. 30 seconds a day for free. But first, hit that like button to help YouTube show this to more men over 50 who are searching for real solutions. And if you're the kind of man who wants to try natural approaches first, type 1 in the comments. Subscribe for honest, research-backed health information designed for men over 50. Now, let me tell you why I'm sharing this with you today. I need to be direct with you about something. I know you've seen the costs. Pills running $40 to $70 per dose. Penile injections costing $200 to $400 monthly. Shockwave therapy clinics charging $3,000 to $5,000 for treatment. Vacuum devices around $300 to $500. Surgical implants reaching $15,000 to $25,000. These are massive investments, and yes, they work for many men. But here's what makes me frustrated as a urologist. Most men spend their retirement savings on treatments without trying evidence-based, low-cost approaches first. Research shows these approaches can be effective for mild to moderate erectile dysfunction. But there's a deeper cost nobody talks about. I've had men sit in my office and tell me things they've never told anyone else. Things like, "Duck, I avoid intimacy now because I'm afraid I'll disappoint her." Or my wife says it doesn't matter, but I see it in her eyes. She misses the man I used to be. One patient told me, "I feel like half a man." That stayed with me. You're not just dealing with a physical issue. You're dealing with your sense of masculine identity, your confidence, your connection with your partner. And the medical industry has convinced you that the only solutions cost thousands of dollars. But what if there's a device you already own, one that uses principles similar to professional pelvic floor therapy that costs $5,000 at clinics, one that could potentially support your erectile function when used correctly, and it's sitting unused in your home right now? I'm sharing this now because I'm tired of seeing men spend everything they have on treatments that don't address the root cause. After treating thousands of patients, I've realized the medical industry has overcomplicated something simple. Before I tell you what this device is, I need to be completely honest with you up front. I'm a realist. This technique isn't a miracle cure. It won't work for everyone, and it's not a replacement for medical treatment if you have severe erectile dysfunction. But here's what I know from both research and clinical experience. Many men can see real improvements using evidence-based approaches that don't cost thousands. The question is, are you willing to try? If you're still with me, let me show you what the research actually says. You need to understand why pelvic floor therapy works. A 2025 review in the International Journal of Impotence Research examined 26 studies. It concluded pelvic physical therapy is an evidence-based first-line treatment for sexual dysfunction. A randomized controlled trial by Dory and colleagues in BJU International studied 55 men. After 3 months, pelvic floor exercises with BOF feedback significantly improved erectile function. The improvement was statistically significant with P less than 0.01. A systematic review found 55 to 83% of men experienced complete symptom resolution. More than half achieved full resolution just from pelvic floor training. Now, can I be honest about what the medical industry doesn't want me to say? Most erectile dysfunction treatments address symptoms, not causes. Pills force blood flow, but don't fix why it decreased. What I'm showing you addresses an actual cause. Here's what's happening biologically. Your pelvic floor contains the bulb spongiosus and isokinesis muscles. These trap blood in your pennies during erections. When weak, blood flows in but doesn't stay there. You get partial erections that fade quickly. The pudendal nerve runs through your pelvic floor carrying signals to your erectile tissue. When pelvic floor tension is high, nerve function becomes impaired. Your erectile response weakens. Professional pelvic floor therapy costs $100 to $200 per session. 12 to 20 sessions means $2,500 to $4,000 total. Can you apply similar principles at home using a device you already own, based on biological mechanisms and my clinical experience? Yes, with the right technique and consistency. Hit that like button if this makes sense. The device is your massage gun, that percussive therapy tool sitting in your closet. Before you click away, here's what $5,000 shockwave clinics don't tell you. They use targeted percussion on your perineum to stimulate blood flow. They charge $5,000. You'll do the exact same thing with a $60 device. Same biological principle, dramatically different price tag. Medical research shows pelvic floor massage releases tension and improves blood flow, which can result in better erections. However, erectile dysfunction often has multiple causes, so this is one component of a comprehensive approach, not a magic solution. Massage guns deliver 1,800 to 3,200 percussions per minute. This releases muscle tension and increases blood flow. The target is your perineum. If you're sitting, it's the area making contact with your chair between your legs, between your testicles and anus. This sits above your bulb spongiosus muscle and near your pudendal nerve. Professional therapists use manual techniques here. During sessions, you'll apply similar external stimulation at home. Important. This is external stimulation only. Professional therapy often involves internal rectal techniques. This is a simplified external approach applying the same core principles. Now, let me share a patient story that shows why this matters. Let me tell you about Michael, 61 years old, married 35 years. He said, "Doc, my wife says it doesn't matter, but I see it in her eyes. She misses the man I used to be." Michael had spent $8,000 on treatments. Pills gave him headaches and embarrassing facial flushing. Injections cost $300 monthly and felt clinical, not intimate. He was considering another $5,000 for shockwave therapy. He was desperate and running out of money. I asked, "Have you tried pelvic floor therapy?" He looked confused. "Like Kegel exercises?" I showed him this exact technique. He was skeptical, but agreed to 8 weeks. 3 weeks later, he smiled for the first time. My wife initiated last night for the first time in 2 years. He'd been doing the massage gun technique nightly for 30 seconds, plus Kegel exercises and morning walks. After 3 weeks, he woke with a full morning erection. He hadn't had that in over a year. That night, he initiated with his wife. It worked. Not perfect, but good enough, real enough. The next night she initiated at 8 weeks, consistent morning erections and improved function. But more importantly, his confidence returned. He wasn't avoiding intimacy or making excuses. 18 months later, still consistent, still seeing results. That's what we're fighting for, not just function, but connection and confidence. Now, let me show you the exact technique. Here's the step-by-step process. Step 1, prepare your massage gun. Any brand works. The gun, Hypervolt or cheaper models. Attach the smallest, flattest head, round ball, or dampener. Make sure it's clean. Step 2, locate your target. Sit on your bed edge or stand with knees slightly bent. Place one finger midpoint between your testicles and anus. Feel for a slight give or soft area. That's your target above the bulb spongiosus muscle. Step 3, apply correctly. Start on low or medium setting, not highest. Place the head directly on your perineum with firm pressure. You should feel deep vibration without pain. If painful, reduce pressure or lower the setting. Warning, if done wrong with too much pressure or wrong spot, you could restrict blood flow instead of increasing it. Pressure should feel like deep massage, not surface tapping, never painful. Stop immediately if you feel sharp pain. Step 4, hold for 30 seconds. Keep steady pressure for the full 30 seconds. Don't move around or lift off. You may feel tingling, warmth, or pulsing. Slight muscle contractions are normal. Sharp pain, burning, or intense discomfort is not. Stop immediately. Step 5, finish and observe. After 30 seconds, turn off and remove. Some men feel increased awareness immediately. That's your pelvic floor responding. To be transparent, research used professional therapy and prescribed exercises, no published. Studies exist on self-applied massage gun therapy specifically. This applies the same principles but is an adapted approach. The biological mechanism is sound and I've seen positive clinical responses. Comment below. Do you own a massage gun and will you try this? Let me give you honest expectations. The technique takes 30 seconds, but you need 30 seconds daily for 8 to 12 weeks. Combined with Kegel exercises and lifestyle changes, that's rehabilitation reality. No shortcuts. If you have mild to moderate dysfunction from pelvic floor tension or poor muscle tone, this may help significantly over weeks to months. If caused by severe vascular disease, nerve damage, hormonal issues, or psychological factors, this alone won't resolve it. You'll need comprehensive medical treatment. Real timeline. Week 1, you're increasing awareness and releasing tension. Don't expect functional improvements yet. Weeks 2 to 4. Some men notice subtle improvements, partial morning firmness or faster arousal. Early indicators, blood flow and nerves are improving. Weeks 4 to 12. Research shows measurable improvements for responders, men whose dysfunction relates to pelvic floor issues. Not everyone responds equally. James, 58, had pelvic floor tension from desk work. After 8 weeks with this technique, plus Kegels and lifestyle changes, noticeable improvement, but gradual, requiring consistent effort. Robert, 65, tried 6 weeks with no improvement. His dysfunction was vascular from untreated high blood pressure. He needed medication and cardiovascular management. Once addressed, his function improved. This works for some as part of comprehensive approach, not everyone. Knowing that helps you make informed decisions. Mistake 1, inconsistency, trying 3 days, feeling nothing, skipping 4 days, quitting. Nerve reactivation needs consistent daily input over weeks. Missing days resets progress to baseline. Do this daily at the same time, non-negotiable. Consistency matters more than intensity. Mistake 2, insufficient pressure. Using gentle settings, barely touching the area. Percussion stays surface level and never reaches deep muscles. Use medium to high settings with firm pressure. Deep percussion, not light tickling but never painful. Mistake 3, wrong location. Targeting general area instead of exact midpoint. Too far forward, miss the nerve. Too far back, miss the muscle. Exact midpoint between testicles and anus. Mistake 4, expecting instant results. Trying once, expecting full erection next morning, quitting when it doesn't happen. You're retraining pathways dormant for years, not medication working in 30 minutes, requires weeks of consistent practice. One patient tried twice. I saw nothing. Almost quit before spending $5,000 on Shockwave. I challenged him to 30 days of perfect consistency. At 30 days, consistent morning erections for first time in 18 months, he would have wasted $5,000 quitting after 2 tries. Commit to 14 days, 30 seconds daily. No exceptions. Days 1 to 3. Get comfortable with the technique. Find the exact spot. Adjust pressure and settings. Notice increased awareness. Don't expect functional changes yet. Days 4 to 7, pay attention to morning erections, even partial firmness counts. Notice if arousal happens faster. Days 8 to 14, evaluate honestly. Most responders see clear improvements by day 14. Stronger morning erections, better quality, increased confidence, but some need the full 8 to 12 weeks. Combine with these strategies, Kegel exercises, contract like stopping urine, hold 5 seconds, relax 5 seconds, 10 reps 3 times daily, walk 30 minutes daily for cardiovascular health, drink 8 glasses of water for proper blood volume, manage stress with breathing or meditation, sleep 7 to 8 hours for nerve repair and testosterone production. Your partner's perspective matters. Wives tell me privately, it's not about sex. It's about feeling wanted. Improving function restores emotional connection, shows your partner intimacy matters. This approach is insufficient. If you have severe dysfunction with no erection ability at all, you need comprehensive medical evaluation and treatment. If caused by severe vascular disease, major nerve damage, or significant hormonal deficiency, you need medical treatment, not just pelvic floor work. If psychological, anxiety, depression, trauma, or relationship conflict, you need counseling alongside physical approaches. If medication-induced, blood pressure meds, antidepressants, talk to your doctor about alternatives. Critical safety note, get full medical evaluation first if you have persistent dysfunction. It can signal cardiovascular disease, diabetes, or hormonal disorders. Don't let home techniques delay proper diagnosis. This is for men already evaluated with mild to moderate dysfunction, or those wanting to try evidence-based approaches before medication. Be smart and use appropriate medical resources. Gentlemen, let me bring this all together for you. Pelvic floor therapy is a legitimate evidence-based approach for supporting erectile function. particularly for mild to moderate cases related to pelvic floor dysfunction. The research clearly and consistently demonstrates this across multiple studies. Can you apply similar principles at home using a massage gun based on the biological mechanisms, the evidence supporting percussion therapy, and my clinical experience? Yes, potentially as one component of a broader comprehensive approach. Will it work for everyone? No, absolutely not. And I'm not going to lie to you and say otherwise. Is it worth trying if you have mild to moderate dysfunction before spending thousands on other treatments? Based on the research, the safety profile, and what I've seen in practice, yes, it's reasonable to try for 8 to 12 weeks as part of a complete strategy that includes lifestyle changes, proper exercises, and medical evaluation when needed. But here's what I need you to understand. This isn't a miracle cure. This isn't a magic trick. This is rehabilitation. It requires daily effort, patience, realistic expectations, and often several months of consistency before you see maximum results. Look, here's the bottom line. You have two choices right now. Choice one, you can keep spending money hoping something will work, pills that cost $50 per dose, injections that run hundreds monthly, shockwave therapy at $5,000, devices, procedures, surgeries. Keep searching for the external solution. Or choice two, you commit to 30 seconds a day for the next 14 days using something you already own. You add proper keel exercises. You make the lifestyle changes. You give this evidence-based approach an honest, consistent effort. In 2 weeks, you'll either feel more confident and capable, or you'll know you need to explore medical options. Either way, you'll have answers, and that's worth 30 seconds a day, isn't it? If this information was valuable to you, hit that like button right now. Comment below with trying this approach if you're willing to commit to 12 weeks of consistent effort. Subscribe for honest, evidence-based health information without the hype, specifically for men over 50 who want real solutions. I'm Dr. kenD Berry. Take care of your health intelligently, realistically, and with proper expectations. Now go try this tonight. Your future self will thank